Well, for remote Indigenous patients, hospitals can be a place of great distress. Their visits marked by injury or family sickness, and sometimes with the death of a loved one.
Well, part of the struggle for these patients is language, not understanding what medical staff are trying to do. Now it's hoped a trial of interpreters in hospitals in Western Australia will lead to better health outcomes.
For many Indigenous patients, hospital can be difficult and unsettling.
People get frightened, get scared. Young people they're not too sure to go into hospital and who to ask, who to talk to. And
it's a fear made worse when English is a second language.
They can't understand much. That's why they just see it too hard.
But a newly created team in Western Australia's remote Kimberley hopes it can relieve some of the stress. 22 interpreters are being stationed at 5 of the region's hospitals. They'll be making sure nothing is lost in translation.
Your blood tests have just come back for this morning and they're looking much better than they did yesterday.
Blood test for good one. Yesterday even proper.
Broome interpreters Ainsley O'Connor and Martina Badal speak 12 languages between them.
Yeah, I think the biggest misconception with Aboriginal people is that they assume that we all speak English. We don't. Some of us don't speak English at all.
Aboriginal people are 11 times more likely to leave hospital against medical advice, significantly increasing their risk of dying. This $200,000 pilot is designed to stop it happening.
I wish we had interpreters in hospitals when my grandparents were around, because... Sorry.
Doctors have welcomed the move.
We see patients representing with the same problem again and again. So, having an interpreter to help clarify that is very important.
The 6-month trial is the first of its kind in Australia, but there's potential for it to grow.
Everyone's just very excited, very proud. They're from the local communities here, speaking local language. It's giving them too opportunity for employment and saying, hey, we validate your language. We need your language in our health sector.
The trial will be evaluated after 6 months. Staff here are hoping it could be rolled out to other hospitals across the state. Matt Bamford, ABC News, Broome.